Hi, this is Pei Zhang. This is our fourth lecture of the certification exam preparation course. And today the topic is the oral exam. The oral exam is also computer-based and your oral responses will be recorded via a headset. The NBCMI oral test is roughly 45 minutes. You will be given 10 minutes for two side translation questions, which are unidirectional from English to your target language, and then 12 mini scenarios, which are bidirectional, where you need to interpret both for the doctor and for the patient. Each of the mini scenarios contains 4 utterances. Each utterance is 8 to 15 seconds long. Then there's 8-second think time, during which you can request a repetition. Then you have 10 to 30 seconds to record your answer. You can correct yourself, and only your last version will be graded. In all 48 utterances, you will have 6 chances to request for repetitions, so you should use them wisely. The question form in CCHI are slightly more complicated because apart from the side translation and consecutive interpretation, you have to do 2 short simultaneous interpretation questions and 1 multiple choice question regarding translation. And the duration of the test is also a bit longer, which is 1 hour instead of 45 minutes. Oral exams are evaluated based on, first and foremost, your accuracy, conveying the meaning without omissions, additions, summarizing, or editing any information. Note that raters evaluate how accurately the candidate preserves units of information of the source speech or text. A unit of information can be an individual word, a group of words, or a phrase that communicates a single concept. When you cannot retain every word in your memory, concentrate on the keywords, like date and time, symptoms, numbers, etc., to make sure you convey the major units of information. Second, listening and information retention skills. Following instructions and retaining in memory the most important information to recall when providing the interpreted rendition. Number 3, grammar. Using correct syntax and usage, and avoiding the use of false cognates, which are words that sound like they should be correct but are not. Raters evaluate the candidate's command of grammar in both languages. On this scale, errors include changes in verb tense or agreement, use of incorrect pronouns, inaccurate word order or syntax in the target language, etc. Number 4, interpreting style. Displaying constantly good enunciation, intonation, and pronunciation, as well as a courteous and professional demeanor, meanwhile retaining the original register. Register is a variety of language used for a particular purpose or in a particular social setting, the level of formality chosen by the speaker. Raters evaluate how accurately the candidate preserves the register of the source speech or text, taking into account natural differences between languages. The general quality of speech is also evaluated. On this scale, common errors include false starts, hesitations, numerous self-repairs, poor pronunciation, or pace that hinders understanding. Number 5, knowledge of terminology and specialties, demonstrating knowledge of a wide range of healthcare specialties and medical terminologies. Interestingly, in the NBCMI oral exam, passing scores are different for each language. To pass the Spanish, Russian, Korean, Cantonese oral exam, your percentage score must be at least 70%. To pass the Vietnamese oral exam, your percentage score must be at least 65%. To pass the Mandarin oral exam, your percentage score must be at least 80%. The official explanation is that there were a bunch of pilot tests given to volunteers to validate the exam. Mandarin pilot study participants performed considerably higher on the side and consecutive portions in comparison to, for example, the Russian and Spanish participants. This result was consistent with higher ratings for the Mandarin item indicating that the exam was somehow easier in Mandarin language. It is hypothesized that the higher pilot scores for the Mandarin oral exam may be due to some inherent characteristics of the Mandarin language, which may offer fewer wrong choices for the test takers. Because the Mandarin test from statistics and average ratings were constantly higher than the Russian and Spanish forms, a correspondingly higher cut score was recommended for the Mandarin oral exam form. And vice versa, a lower cut score was set for the Vietnamese oral exam. I cannot emphasize this enough. Note-taking is strongly recommended. Do not try to write down every word. Concentrate on the keywords and ideas so that you will be able to convey the correct meaning. Do not omit any unfamiliar terms, but instead do your best to explain them. We will talk some more about note-taking in our next lecture.